Holbrook Travel is pleased to bring you this webinar today, Group Travel During COVID, Travel Planners Share Their Experiences. We know that a lot of you as travel planners and group leaders have questions about what it's like to travel right now. Today, we'll be discussing how international group travel is not only feasible, but how in certain destinations it's thriving. Certainly the decision to resume travel is not an easy one, especially as it pertains to organizations or institutions, but with proper precautions, many travelers are eager to begin exploring again. And so today we'll address how we can support you in making that happen. In just a few moments, I'll turn it over to Andrea Holbrook, President of Holbrook Travel, to kick things off. Andrea, as well as Holbrook's VP, Laurie Mclaughlin, will talk about the company's current practices as they relate to COVID. We're also delighted to be joined by several trip leaders who've recently returned from leading groups into the field, and they'll be able to give their own perspective on the planning process and the actual experience in the destinations that they visited. We've already received some really great questions, and we anticipate that you'll have more as we go along, so we'll have time at the end to share those with our panel. So first, I'd like to welcome Andrea Holbrook. Andrea is the president and CEO of Holbrook Travel since 1998. The Holbrook was founded in 1974, and the company was a pioneer in eco-travel with a mission to foster sustainable travel. Andrea also serves and oversees operations of Selva Verde Lodge and Rainforest Reserve. And she's a board member for organizations including the Sarapiki Conservation Learning Center, the Center for Responsible Travel, or CREST, and the Climb for Cancer Foundation. We're also joined by Laurie Mclaughlin, who is the Vice President of Customer Services for Holbrook Travel. She's been with Holbrook since 1987, and her travels include over 30 countries throughout the world, and she is also our resident airline expert. So if you've traveled with Holbrook, you've likely interacted with Laurie. She also manages services across all aspects of Holbrook. We think of her as our problem solver, and a lot of times she's our on-call person as well. And when she's not at the office, she's most likely playing tennis. Our guest panelists today include Paige Keeley. Paige is an independent consultant, speaker, and author. She's a prolific author of over 20 national best-selling and award-winning books. Paige is also a leader in science education, the former president of NSTA, or the National Science Teachers Association, and she is currently involved with professional development in school districts. We're also joined by Melanie King, Director of Development at the Tennessee Aquarium. Melanie is a passionate advocate for lemurs. She's traveled throughout the British Isles, Europe, Canada, India, Greece, and Central America, and her favorite place is still Ireland, where she was born. And we're joined also by Rainier Mongia. Rainier is a nature photographer with a strong conservation vision. Rainier has published numerous textbooks and magazines and is a frequent speaker at wildlife festivals. And his focus is on educating people about nature. That has become his most important goal. So at this point, I'd like to turn it over to Andrea Holbrook. Andrea, welcome.
Lindsay, thank you so much for that great introduction. And I'd really like to thank our panelists and friends, Melanie, Rainier, and Paige, for taking the time to share their experiences in this webinar. And to thank all of you for joining us from corners near and far. I know some of you in the audience have led groups already in this period, since March of 2020. And I really look forward to a lively discussion and dialogue, because this is really a forum that we created specifically for leaders and organizations to sort of talk about what it's really like and what are some of the that unique aspects of travel since the pandemic began. I can't stress enough, I think travel is always a word of mouth kind of pursuit. It's really through our friends and extended networks that we learn about, the far corners of our world, or even the places around the corner. And I think that's even more true now during in this post March 2020 period. I can't really say post-pandemic, because really we're still in the midst of it in many ways. We're coming out of it, and So I would say that just having hearing the experience of other people is just so important. And that's why I'm just so thankful for Rainier and Melanie and Paige to talk about what it was like, first and foremost. So we will keep our presentations succinct so that we have a lively discussion, hopefully afterwards. From Holbrook's perspective, after March of 2020, one of the first things that we had to undertake after just coping with the tremendous shock of what it meant for us and for our industry in looking at moving forward was the creation of a COVID task force. So we did create a task force that began working on all aspects of sort of seeing our way through this. And I think primarily sort of understanding the guidelines in place, for travel from the US to each of the destinations that we operate in as they began to open. So just being very on top of each destination and their own COVID policies and understanding what that meant for our travelers. Also developing guidelines for our own Holbrook policies and procedures. That was, a part of that task force. And finally, working closely with our field partners, both domestically and internationally. We do some domestic programming, and that actually increased during this pandemic time. So trying to ensure that those guidelines are either, our minimum guidelines are met or exceeded in each country. So I talked a little bit about that first point. So I think we can go to the next slide, Lindsay. Thank you. So one of the first, key points that we were able to implement really as it became, widely available in the United States was a vaccine requirement for all travel. We just felt that was so important given the fact that we work with group travel. So there are people from different bubbles, so to speak, coming together, and that was something that we needed to do and implement here. So that's been an important piece that I think is critical. Then within each destination, there are a whole variety of things that are just really common sense things, that things like face masks in, or masks in, when enclosed areas such as vehicles or, indoor spaces, hand washing, sanitizing, and social distancing as possible and as needed. Of course, during flights and many other situations, inevitably you're not, able to social distance, but do it as possible. Normally, what we found within our groups is that they become kind of a bubble, and sort of as the trip progresses, they're sort of more and more integrated. And so social distancing, is particularly at the beginning or early part of our trips was really more between our groups and the local people, as it were, just to make sure that we were keeping ourselves and themselves safe. And then our in-country group leaders, it's hard to stress just how important that role is. All of you have traveled internationally know just what a key role that is. And it's just, they really take a lot of the burden off of groups and group leaders, US group leaders, in terms of just laying out the protocols and making sure that everyone has all the information that they need. So that's been a really important piece. The other thing that's been really important during this time are pre-departure. So people have a lot more questions prior to departing, and a lot of information bears repeating a number of times. So just sending information in writing is not enough, and in some cases, Zoom meetings are important for, to get the group ready and feeling prepared to travel. In terms of, deposit and cancellation, our policy is essentially, we have an average $300 per person deposit, of which it's fully refundable with an admin fee of $100 per person. That's our standard. And we will be going back to that after March 31st of 22 for travel. And we do feel that it's just sort of flexible and low risk for our travelers to be able to not feel like they have, great amounts at stake, but yet being able to ensure that we have group numbers and enrollment numbers. So I'll wrap it up just by saying that we feel incredibly pleased, privileged, grateful, and many other things to say that, since we began operating in essentially late December, early January of last year, of December of 2020, January of 2021, we've had 77 groups to 8 countries, almost 900 participants travel. So it's just very, very encouraging to look ahead to 2022 and to see, I think, positive signs on all accounts. So thank you so much. And I'll turn it over to Laurie Mclaughlin, who'll go into a little bit more detail.
Okay, thank you. Thank you, Andrea. As Lindsay outlined a few of my roles here at Holbrook at the beginning, a new one that I took on middle of last year is one that I'm really ready to get rid of, and that's kind of the COVID ambassador. So that is a title that I'm really ready to hand off or have no need to ever have any again as soon as possible. But as Andrea mentioned, early on, we established our COVID-19 team. We were responsible for starting, to understand what's happening in the different countries, what's their vaccination ratio going on in the countries, how the tourism sector was faring as far as that's concerned. And a lot of countries, the tourism sector got moved to the front of the line, if that's, where that's a key element of their economy for that. So that's good for us in some places like Costa Rica. Anyway, we're meeting bi-monthly to kind of review any updates for the countries that are going on and try to keep our information as organized as possible so we can keep everybody as up to date as possible on what's happening at any given time when a country begins to open, when they change their requirements for the opening, etc. And we also then are checking with our vendors in the field, our partners in the field, to make sure that they have the protocols set up to make it as safe and secure as possible for our participants. Many times we find that the country's protocols are even more stringent than anything that we would be asking for. So we have many people that have come back, and I think people will attest as well, that have said that they felt more safe traveling around in those countries than they did going to the supermarket at home. So certainly, as far as that's concerned, people feel really secure. We kind of, in order to keep people engaged in understanding what's going on and to be able to make the right decision for them as far as whether or not they are, feel it safe enough and willing to travel at this time, your Holbrook coordinator would contact the trip leader or trip organization to kind of review what the current policies are in place, what your group numbers are at this time. Do we feel like we're ready to move forward to try to make this definitely happen? Do you feel secure in making this happen? And then once we have that under control, then we take over, and our operations teams contacts everybody in the field, make sure all of the activities and locations and everything, there haven't been any changes or cancellations, make sure all the program is valid and able to go. And if something needs to change, that we're able to let people know prior to their final payment of any kind of changes that had to be made to the itinerary due to those changes. And also around 120, 110 days before the final payment deadlines for the majority of the programs, we make sure that the participants understand what the current protocols are for that country and what's required in order to travel at that time, so they can make the informed decision before they make their final payments. So we try to make sure everyone knows what's going on. And then when the final documents go out around 30 days or so, then there's another update of what the current status is at that point. And then another week or so before, we'll send another reminder saying this is what you need, because things do change on a dime. We go from telling people one day you must have a PCR test to the next day, no, you don't need anything. you're leaving next week. So it definitely changes fast, and fast and furious. So the main thing we want to make sure everybody understands is the requirements can change. Luckily, for the most part, they're getting less strict as opposed to more strict, but that again could change on a dime if things happen again. Is there another slide, Lindy? Yeah. So then when we go to in the field, we try to ensure that our group leaders are vaccinated and that our primary drivers are vaccinated. And in some cases, the drivers are a little bit more difficult to be sure of the vaccination, but if they're not, then we make sure that they're tested prior to the group arrival, and we have someone as a backup if they're not available, if they happen to test positive. So it's very important that we make sure that for your safety and for theirs, that that they're good and healthy as well. Otherwise, basically the requirements that that particular destination has takes precedence. Beyond that, Holbrook requires vaccinated travelers only. Some countries don't have a requirement for that, but they have a testing requirement. But otherwise, the requirements for that particular destination will take precedence over what the needs are. And so it's in our thank you. And the other thing then to consider, though, is some destinations require that you have insurance that covers you in case of COVID. Now that they have a requirement for entry that you can prove that you have that coverage. And for those that don't, we still think it's very important that you do have coverage, medical insurance for travel at any time, but especially during this period. And you want to make sure that as you begin to investigate different options, that they cover COVID-related issues. For the most part, COVID-related issues are treated as any other illness as far as insurance for cancellations, for travel delay and things like that. Just like any other illness is treated in that manner. But when it comes to having to quarantine because you've tested positive, it's not something where you are hospitalized. So it's not really under the medical purview, for instance, per se. You want to make sure that you have coverage that will cover you should you be required to isolate in the country before you can come back. Most have a travel delay policy in place, but this sometimes is a minimal amount. So you want to make sure that if there's an option to upgrade to include additional coverage for, some call it bed rest, some call it for isolation or quarantine requirements, etc., that you investigate that as well when you're exploring your options. You just want to make sure you have all the coverage that you need in case of an emergency. I think that was yeah, so I think as I said, it's we're doing all we can to try to make sure everyone is informed as possible to make the decision that's best for them, and in the field trying to make sure that we have following all protocols to keep everyone as safe as possible. That's it. Thank you.
Great. Thank you, Laurie. Thank you, Laurie. Thank you, Andrea, both. At this point, I'd like to welcome Paige Keeley. Paige traveled to the Galapagos earlier this year with a group of science educators, and she is going to share a little bit about what that experience was like. Hi, Paige. How are you?
Great. Thank you. So before I begin, I just want to mention that we all have some slides of photos that we took during our trips to share with you. They are in no particular order, but they'll serve as a visual and hopefully get you excited about visiting some of these great destinations. So I have led 9 international trips in 6 continents, 4 with Holbrook, and I have to honestly say that this trip to the Galapagos during COVID in July was the most challenging, yet it was the most rewarding, particularly since it was the first time that many of us had been out of the United States in almost 2 years. But one of the things I found was a challenge, and it's very important to keep in mind, was the sheer amount of communication that had to take place before departure, more so than with any other trips I have ever led. And it was primarily around COVID, especially since in July, the requirements just seemed to be changing from week to week. So keeping in touch with your participants regarding the COVID protection and protocols and policies is very important. Typical questions about vaccinations, about testing, about where to get tested, when to get tested, what happens if you test positive, and so on, come up again and again. And it's really important to reassure your participants that these things will be well taken care of. Fortunately, we got a lot of help from Holbrook, especially Kevin, who was very prompt in answering my questions, which I then would relay to my group. There were also a lot of worries about flying, since many hadn't been on a plane for more than a year or so. So we shared airline tips such as double masking, trying to avoid going to the bathroom if possible, trying to get a window seat so only one side was exposed to people. I also checked out the hotel's COVID policies in advance by going to their website, as well as our ship, the Bonita, and I shared that with the group. So overall, all of these things were really important in putting people at ease. It was also really helpful to have that pre-departure Zoom call with Holbrook to answer questions, which we then relayed back to our participants. So let me tell you a little bit about our experiences starting at the beginning when we arrived at our launch city in Guayaquil. So everyone at the airport was masked, just like in the US. When we met our guide, he was masked. Our driver was masked. We arrived at the hotel and everyone was masked, and there were sanitizing stations everywhere. There were limits on the number of people who could go into the elevators. Our walking tour of the city of Guayaquil before departing for Galapagos gave us some insight into how serious Ecuadorians were about COVID. Most people were wearing masks. Masks were required in congested areas. But given that we were walking in 90-degree plus temperatures, there were times when we had to take a mask break, and that was okay, as long as you were not in a crowded area. But when you were back in a crowded area, you had to put your mask on, and there were actually police stationed throughout the city. And at one point, I forgot to put my mask back on after taking a break, and a policeman came right over to me and pointed at my mask, and I remembered then to put it on. So they're very serious about it. They had mask police everywhere. Imagine what that would have been like in the US. So overall, we felt very safe with our group. When we got on the plane to go to Galapagos, same thing again. Everyone in the airport was masked. Everyone on the plane was masked. When we went through the entry requirements in Galapagos, everyone was masked, sanitizing stations everywhere. When we got to our boat, the Bonita, we had a fully vaccinated crew, yet they wore their masks all the time when they were around us, including when we were on the pangas, or if some of them went kayaking with us, or some of them walked on the trails with us, they always kept their mask on. The common areas were sanitized each day. We were given snorkel bags so we could keep our masks and our snorkels in our own bags, so there was no need to dip them in the sanitizing fluid they often use on ships. So we kept our same snorkel gear during the whole trip. But you may have noticed on my slides, if you look at the participants, that we weren't always wearing masks. And that was a decision that we made as a group. After our first day on the boat, we talked about wearing masks if we felt safe taking our masks off when we were out in the open air on our excursions, or even on areas of the boat. And it had to be a consensus of the entire group. If anyone felt unsafe, then we all agreed we would put the masks on. So we voted in consultation with our guide that we would take our masks off when we were together just as our small bubble. So we felt safe when we were out on the trails. If we passed another group, we put our masks on, probably more as a sign of respect to others than our worry about catching COVID. And the few times when we went into some of the towns, we always wore our masks. So it was nice because we were outside, so we could relax the mask policy. Overall, we felt a lot safer in the Galapagos than we did in the United States. And I was in Italy in September. And again, I felt much safer because in the Galapagos, we were doing outdoor activities, unlike being inside museums and cultural areas where people were close together. So I think that's one of the key features of a Holbrook trip, to emphasize to participants, is that we spend most of our time outdoors in the open air. I was also amazed at how well coordinated the COVID testing was for us. It went so smoothly in departing back to the United States. Our guide arranged to have the lab come to us. And of course, we had to have that dreadful test of the swab that goes practically up to your eyeballs, but it went quickly and we got our results in hand on paper in, I think it was less than 3 hours. So the last thing I want to mention is that travel during COVID had a deep empathy factor for all of us. Most of our guides and all of our crew had pretty much lost their income for the past year. And that was really quite surprising to us. And even though Holbrook covers the tips, we all were very generous in providing additional tips to our guide and our crew, considering how much they had to put up with in the past year. And they were just so happy to see us. I mean, they treated us like family. In some ways, it was the best time to travel. And at the risk of anthropomorphizing, I also have to say that I think the animals at the Galapagos were really happy to see us. I don't think they'd seen humans for practically a year. And the sea lions were definitely our welcome committee. So that was pretty fun. So even though the pandemic with all these variants and vaccines are probably going to keep us guessing for months to come, I think people are ready to travel if you keep them informed, if you find experiences that are mainly outside, that you travel with a group that keeps you in your own bubble with people that you trust and with groups that you have faith in, like Holbrook. And know that flexibility is key. That's one of the things you need to emphasize to your participants. Things are constantly changing and we all need to be flexible. But above all, travel is just what we all needed during that time after being dragged down with this pandemic. And to end, if I were to summarize our trip in a few short words, it felt like renewal. That's what it was. And so I hope that gives you a sense of why it's important to get out and travel and how it felt very safe to us. Thank you.
Wonderful. Thank you so much, Paige. Yeah, thank you. Okay, next I'd like to welcome Melanie King. Melanie recently traveled to Costa Rica and she'll be sharing a little bit about her experience there. Melanie, welcome.
Thank you. I'm really excited to talk to you about Costa Rica today and about travel. We traveled in August to Costa Rica. And as a little bit of background, I took over the travel program for the Tennessee Aquarium in 2019. We had 3 trips that were on the books for 2020. One we were able to accomplish right before COVID, which was Cuba, and it went well. And then we had Madagascar, which was canceled, which really killed me with my love of lemurs, but someday I will get there. And then we had Costa Rica, was also canceled, but we kind of kept it on the books to try again. So this was my first time working with Holbrook on this trip. I had not worked with them before. I have been a host on trips before, but this is my first time managing the travel program. So we had folks from that 2020 trip that were really game to try again and contacted me and were very eager to see us get this going again. So it was kind of with the original, these group of 5 really pushed us to investigate this. And, you know, working at a science-based organization, you know, when we investigated and looked into everything, we wanted to do this in a thoughtful way that was safe, that we'd done our research on our side, because we did feel, you know, we're telling people that we're representing this, so we want to make sure that it goes well. So we felt very confident in talking with Holbrook about the plan to move forward. So I think that everyone, as I said, the 5 original people and then 2 more from that group came back as well. We ended up being a group of 12, which I think was really manageable for doing something like this that's a little bit unknown. I would kind of describe us at the beginning, we didn't really know each other, but I would say we were game for it. We were excited. We were definitely cautious. A lot of what I'm going to say is actually going to echo some of what Paige said, and we haven't heard each other what we were going to say today, but it was interesting. A lot of things you said, Paige, resonated with me on this for our trip as well. Definitely having that group Zoom with Holbrook helped a lot. It was nice to see each other's faces. Under normal circumstances, I probably would have tried to get us together in person to do a dinner or, you know, get together in some way. But obviously we didn't want to risk anything like that. But having that Zoom and being able to see each other's faces, I think started to get everybody a little bit more excited. I did get a lot more phone calls after that because, of course, they didn't really know me. So once they saw me on Zoom, it was very much, you know, a lot of phone calls. And it was in other times when I've done this, the calls have been more about what should I wear? What should I pack? You know, what about this? It was all very much like health safety type questions that they were interested in. Holbrook was there for us at all times. Response time was excellent. A lot of patience, you know, especially around things like paperwork. And if you see that picture of me there on the left, I was the dummy that didn't get my QR code quite right. And so had to be taken aside while the rest of the group did their QR codes perfectly. So these are the things that happened. Something was wrong with my QR code. And so I was taken to a special section. And I will say the Costa Ricans, as they were the whole way through this trip, were absolutely delightful. But that's what I'm doing there. While the rest of my group has completed that part of the trip. But things like this pop up, you know, there's just a lot of paperwork and things to do. So anyway, I would say we were really excited when we got to the airport in Atlanta. We definitely felt, you know, this is our first time traveling for all of the group. You know, I was surprised to see like everybody was wearing masks and even over their noses, like actually proper mask wearing. So it was really good to see. I think we were starting to get really excited about it. They did say, you know, on the flight that, you know, if you went to sleep and your mask was not on, they would gently wake you and gently remind you to put that mask on. So you know, we knew they were taking it really seriously from the beginning. When we arrived in Costa Rica, we could tell from the beginning that Costa Rica took this very, very seriously. Again, to echo some of what Paige said, everyone that we met was wearing a mask, lots of hand washing, lots of cleaning and that kind of thing. So, you know, we really felt from the very beginning that all around us arriving in Costa Rica, that people were definitely taking this very seriously. Our guide was exceptional in terms of, well, it was exceptional the whole way through the trip, but particularly just sort of setting the scene of like how this is really, really important. And something that he said to us, I think really resonated with us throughout the trip was, while we are all very lucky that we are vaccinated and able to travel, many of the people that we met in Costa Rica have not had the luxury of even having the opportunity to get vaccinated. So we were very mindful of that as much as we were worried about our own health and safety, we also really cared about the people that, you know, we were engaging with. We didn't want to do anything that would impact them. And that really stayed with us, I think, throughout the trip, that we were like, you know, we're so lucky that we've all been vaccinated, but a lot of these people haven't even had the opportunity to say yes or no to a vaccine. Everywhere we went, from the bus, we were on and off buses quite a bit. Our driver would meet us with our hand sanitizer and spray us, and we'd, you know, get our hands clean getting on and off buses. Just about everywhere we went, there were some kind of makeshift hand washing stations outside of places that probably normally would not have a hand washing station right outside the door. So that was always nice to have as well. Sometimes there were temperature checks, sometimes, but mostly it was to do with hand washing and, you know, definitely mask wearing as well. So I do feel, you know, much of what we did was outside. And, you know, that I think added to it a lot as well, in terms of, you know, we felt very, very safe. Some of the places that we stayed had screens, that mesh screens. A lot of the places that we ate were open air, covered at the top, but, you know, we had lots of open space around us. we did what Paige did and kind of had a consensus that when we were in a group type setting, that we would take our masks off when we were outside with plenty of space. And again, if we were around other Costa Ricans, we put the masks back on for their safety. That was really, really important to us as well. Most of the places we ate, the lunch spots and things like that, were really open, lots of hand washing stations, as I said. So it felt very safe to eat outside and to be outside. Of course, it's a beautiful place, so you can be outside all the time. So I think, what I took away from it was that, and again, this is what was said before, Costa Rica really wanted this to work, really wanted this to go well. We were among the first people they'd seen in a really long time. And, they thanked us so much. I mean, it brought tears to your eyes on several occasions. We were thanked so much for taking that chance, for choosing Costa Rica. And so there was a lot around being very grateful, and it was, not terribly crowded. So again, as it was a complicated thing to do, it also gave you this incredible opportunity to be in a country that wasn't overcrowded with people that were just so excited to see you. One thing that resonated with me was Sarah Piqui. We were out on whitewater rafting, and I was asking our guide, what happened to everybody, like when this was shut down, and he was talking about, they went to work at Amazon in the warehouses. Nothing against Amazon, but when you're somebody who loves to be outside, that had to be really, really hard. So, again, same thing, like we over-tipped, we bought things we didn't need and that kind of thing. So everything about it went exceptionally well, right down to the COVID test at the end was done very well. So I think, I would just say, I think it's important for us to get out there, to do it safely, but life is short. And I think if you pay attention to science and pay attention to the information, it can definitely be done. So I look forward to any questions you have afterwards. But I'm glad I had a chance to talk to you about our experience.
Thank you so much, Melanie. Just really appreciate those words. Now we will turn to Rainier. Rainier, looking forward to hearing about Kenya. So welcome, Rainier.
Thank you so much, Andrea. So yeah, we had to cancel our trip to Kenya in 2020. So finally in 2021, we decided this is the time to do it. We were clear in terms of, we knew that we could get into the country and everything was fine, but we needed to actually go through certain protocols that we were not used to. I've been leading trips since 2006. I've been to Galapagos, Ecuador, mainland, all over Panama, Central America. But this was the first time that we were going all across the globe to visit Kenya. And that alone presented a lot of challenges. First of all, our flight time. I mean, we were traveling, one flight was about 8 hours and a half, the other one was almost 9 hours. So obviously we were gonna spend a lot of time in the airplane. Everybody in our group, at least we knew from the get-go, is that everybody needed to be vaccinated. And obviously that was an advantage because at least we have a level of security that everybody in our group was already vaccinated. So that's really important. And a lot of countries are gonna take that attitude from now on, is that they're gonna make sure that you are vaccinated. You will get it a lot easier into the entry process to any country right now if you are actually vaccinated. So that little card means a lot as travelers. So our main goal to go to Kenya was to obviously see all the wildlife and be able to photograph all this beautiful wildlife. So that takes us all the time on the road. We're gonna be spending a lot of time together. And like Paige and Melanie mentioned already, we got to an agreement among all the participants. Okay, we are together, we've been traveling together, so we all were tested. And that's where the QR code comes from. We had to actually show proof that we were tested. We had to file paperwork with the CDC in Africa. So obviously we were prepared, but it took some learning before we got everything the right way. But once we were there, we decided, okay, well, our guides are already vaccinated. So as we wear masks at all times when we were with them for the first few days, out of respect, we were told later on that they were all vaccinated and that they're required by the government to wear a mask at all times that they are with travelers. So for us, we kind of felt bad about that because, we were trying to get a little relief from wearing the mask when we were all together. But obviously, every time that we went in common areas inside the lodges, or if we visited a restaurant or any preserve that we were in close contact to people, we actually have to wear our mask. Is just protocol, and it's the right thing to do in this kind of situation. But even with the airlines, getting all the paperwork and the requirements from the airline was a little bit of a struggle at first, because nobody knew exactly what they were requiring, because we had to take 3 different airlines to get to Kenya. So we flew with Delta, we flew with Air France, and we flew with KLM. So each one of them had different protocols. So we needed to make sure that we have everything that they needed. At the end of the day, they wanted to have that barcode or some kind of form stating that you have taken your COVID test prior to your flight. We were given 96 hours between the moment that we get tested and the arrival to Kenya. So obviously that was a bit of a challenge, because if the test did not come, the result did not come on time, we could not get into our flights to leave the US, just to start. So at first, it was like we were all freaking out. Then we found out that there's really good ways that you can get tested and get your results within 4 hours right here in this country. And a lot of people were paying big money to get tested through these private labs. And I found out that you can actually go in a lot of the hospitals, the regional hospitals offer COVID for travelers, and it was really inexpensive, $100. Test came back in 4 hours. So obviously that was a peace of mind. I actually got tested by CVS and by my local hospital. I needed to have a backup just in case one did not make it on time. I had the other one. But I think that all that is now a lot better. I think that we are in the right process of getting a system that works for every country. I can tell you that I traveled to 3 different countries this summer, and in Costa Rica, I had the same experience that Paige and Melanie had. We were able to get tested in no time and get our results and be on time for our flight, our returning flight. So those are just logistical things that you have to consider, because you might run into a little bump on the road, but it's not impossible. At arrival to Kenya, everybody was checked. We were checked for temperature. We were checked to make sure that we had all the paperwork that we needed to have, including if we have vaccination cards, they wanted to see them. They wanted to see that we had the QR code that they request that states that you actually were tested prior to jumping on that airplane. And that is, it seems to be the protocol in a lot of countries that require you to be tested prior to arrival. So it's just a matter of getting used to the process and make it happen. So here we are, the whole group together, with no mask. We're walking, we're in an open area, and we have been all together for the whole length of the trip. And we were all vaccinated. So that gave us the freedom to, in a way, still enjoy without having to wear a mask at all times. But every time that we would come close to like the guides or the guys that took us to this island by boat, they will wear a mask, just because we don't know if they have been vaccinated or not. And at the end, we wanted to protect them. We also have the same experience when we decided that we were going to visit one of the Maasai villages. We had already collected on our way out of here, the United States. I told everybody, you have to bring me 1 box of gloves and 1 box of at least 50 to 100 masks, because we're going to take them with us. So what we did, we went and visited the Maasai village, and we actually took all those goodies, because these people are totally isolated, but they still receive visits from travelers. So we wanted to make sure that they had also a level of protection for the next group that might come in and visit. So we took care of all of that just to make sure that everybody was safe. And I tell you, like Melanie mentioned and Paige, wherever we went, we were treated like old-time friends that just came back for a visit. In Costa Rica, that's my case, because I've been leading tours there since 2006. So seeing the people again, and they were telling us the same stories. We are so glad that you guys are back, because these are countries that are highly dependent on tourism. So obviously a year without anybody coming and visiting, it really digs a big hole. And their livelihood is at risk if we don't continue to doing our traveling. So here we are all masked with the Maasai. The one in the middle is me with a hat of a lion skin. Don't ask me how I got there, but it was interesting. So we were all like trying to be as safe as possible with them. Fortunately, I mean, when people, there were a lot of questions before traveling. I have people that decided not to go on that trip because they say, oh, but Kenya, you can imagine the number of cases there. Well, guess what? Kenya was better than Florida any given day while we were there. So the number of deaths associated with the virus were nothing compared to what we had in just half a year here in Florida. So when they discuss the level of COVID threats for each one of these countries, they say, oh, but they say that it's a level 3 or a level 4. I say the United States don't even tell the level because it's past 5. So in reality, a lot of these countries were taking really good measures from the beginning because they know that they don't have all the facilities for treating that many people if they were to get infected. So every place that we went, they were make sure that, you know, we had our temperature check in hotels. They will hand you sanitizer the moment that you walked in, and they wanted to make sure that you had your mask at all times. So in reality, yes, we can still travel and travel safely if we follow the rules. If you're not willing to do that, then don't do it. I tell you, at the end, when we were ready to get tested, we were able to get, our guides were able to schedule to be tested in the middle of the Masai Mara. We were about an hour away from the lodge in the middle of nowhere with gazelles moving around with all kinds of wildlife. And we went there all the way to the airport. They took the samples right there, and the lady that you can see it right behind the vehicle got into an airplane and flew back to Nairobi so that we could get our test done, processed and on time for our flight 2 days later. So reality, they did whatever, and they went beyond what we were expecting just to make sure that we get everything on time to get our flights back to the US. So here we are all sitting at the Kikorog runway. This is an airstrip in the middle of the Masai Mara, just waiting to get tested. So this was probably one of the highlights of the trip. I mean, everybody made a joke out of this one. And we all have pictures of them putting a swab up our noses. So it was like the highlights after seeing all the cheetahs and lions and all this. This came as a second best. So if you have any questions, I think that we're going to move on now to answer some of those questions you might have.
Wonderful. Thank you, Rainier. Thank you to all of our panelists for sharing your experiences. Yes, we want to make sure we have enough time to get to as many questions as possible. We may go just a couple minutes over because, again, we have so many good questions. But let's open it up. I think Rainier brought up a good point about the State Department levels for travel. I think that's maybe a good place to start. Laurie, can you talk just a little bit about kind of Holbrook's thoughts about the State Department levels and how those are assigned and how we kind of adjust our procedures accordingly?
Well, generally,
I apologize. I unmuted one place, but not the other. So you have two different things. You have the State Department level 4 and you have the CDC level 4. In the past, the State Department level 4 was more about security and those type of risks. But back in last April, the State Department added the CDC levels, updated, merged them, so they're the same. So now they all look the same as far as that's concerned. For instance, Costa Rica has been a level 4 all along, and you've heard Melanie's and Rainier talking about the travel there. So it's, you know, it's the thing is that it's about being safe yourself and making sure that you're doing all you can to be secure. I saw someone ask a question about Belize, also is listed as a level 4 at this time. But again, it's all about making sure that you're doing all you can to make sure that you're as safe as possible. And we will do all we can to make sure that everywhere that you go, that proper protocols are being taken care of, and that the people that are with you the most are also vaccinated and taken care of as well.
Great, thank you. We have, this is a good question, and I'd like to put this to our guest panelists. Has it been tough recruiting participants to travel with you? We have someone who says they're concerned that they won't get enough participants to make the trip affordable for their institution. I'll put that to Melanie first. Can you talk about that just a little bit, please? Did you have trouble with that?
A little bit, yeah. I mean, like I said, in the particular case with Costa Rica, I was going back to people who had planned to do that in 2020 when it was canceled. So I did get, most of them back, but there was another, I think 5 or 6 that elected not to. We did it a lot by word of mouth. I sort of reached out to people that I thought might be up for travel, that were, a little bit adventurous or that are traveled extensively who would, who'd maybe join us. So in that particular case, I did it sort of word of mouth and sort of spreading the word among key people. I sort of looked at a group and figured this is probably my best group for doing that. We haven't really started up anything new yet, but I did sort of ask some folks about, possibly going to Madagascar. And that one still has been a little bit resistant so far. I will say, like, one of the reasons that for me, Costa Rica is just, it just didn't seem that far away. It was like 4 hours. It just seemed very doable. So, I know everybody has different things that they're looking to recruit for, but for us, I think that one was pretty easy. And I really think I could do another Costa Rica trip pretty quickly because it was quite accessible. But I do think there's still a little bit of resistance. And I think it's more if you can use word of mouth among the people that have already traveled with you to have them help you recruit. I think that would really help at this current time.
Great, thank you. What about you? Yeah, what about you, Rainier? You went to a destination that was a little bit further afield. What was that like?
Right. Well, we're not finding so much of a problem with that. I'm going to tell you, one of the problems that we faced was that because people were stuck in their homes for almost a year without being able to travel. The ones that were traveling, they were traveling nationally. So you probably heard that 2020, we have more visitation to national parks than in the history of the national parks, which was one of the things that actually triggered a lot more infections throughout the country. So a lot of, I had 2 sessions to Kenya on 2021. Both of them had to be canceled. One of the groups canceled automatically because they had the fear of going so far away when COVID was hitting so many countries. It's the irony of things. Those people that decided not to go that year actually got COVID right here in their own backyard. So reality, if you're gonna get this, you can get it from any place. So traveling to a country doesn't mean that you're exposed more than you're exposed here. So bottom line, the answer is you have to follow the rules and try to stay as safe as possible by wearing a mask, getting your vaccinations. So at this point, I think that we're doing fine in terms of recruiting people. We're getting more people that are interested in traveling because they feel that now they're more at ease now that they're vaccinated, and we have different protocols in place for travel.
Great, thank you. And then I'll ask Paige as well. As far as recruiting travelers for your trip, did you find that was relatively difficult or relatively easy to do?
Yeah, well, our trip, we actually recruited our participants before COVID, and we were full with a waiting list, but then COVID hit and we lost about half of our participants. And one of the concerns that they had was that it's so isolated when you're out there. You're out on a boat, you're around islands where there are no hospitals, even human habitation. So that was a concern from some of the people who decided not to go. But I have a trip to Costa Rica coming up in July. And I think now that I know so much more about the protocols and the policies, I don't think it's going to be a problem to recruit people because I'm much more informed about how it works. And I think participants are more willing to go somewhere where they know they're going to be health services there if needed. So I think that Galapagos was a little iffy because of the isolation factor.
Sure, that makes sense. Andrea, did you want to jump in?
Oh, I just wanted to add that, as has been reflected by everybody, and Rainier in particular, people, there is a certain pent up demand. And so as we've all experienced throughout this time since the pandemic began, it's been very much an up and down kind of scenario. We did experience quite a cool down as the news of the Delta variant became very widespread. But as time has progressed and vaccination rates continue to increase, Melanie, since you traveled in August, vaccination rate in Costa Rica's climbed a lot. So your the average person that you're coming in contact with in Costa Rica is vaccinated now. It's probably, I want to say 58 or beyond 60% right now in Costa Rica for adults, that are eligible. And so they're climbing. I think that people's mood is very variable, right? How people perceive the safety is up and down. But I think right now there is a sense with boosters widely circulating that it's just a sort of temperature, but I've learned to trust it. The temperature gauge just goes up and down. Right now, I would say the temperature is heating up pretty quickly, and people are game again. So I don't know if that answers the question of the person about recruitment, but I think there's many, many positive things that do support recruitment, including just the sense that people are ready, and particularly for the beyond the first quarter. I think the first quarter has experienced some downturn because of the Delta variant, but I think starting with the second quarter and on for the next year, I see it as very strong demand actually.
Okay, great, thank you. We've received quite a few variations of this question, so for the sake of brevity, I'm going to try and condense it. We have a lot of questions about what happens if somebody tests positive while they're in the country. What are the procedures and the protocols for that? First, I'll ask, because somebody did put this in the Q&A, Laurie, someone asked how many of your staff and participants have contracted COVID during their travels. Would you mind addressing that?
This my head is wood, 0. Or at least to our knowledge is 0. It's people got it and tested negative before they came home, but still were positive once they got home. We haven't heard anything about that. So far, we have been very lucky and blessed that the answer to that is 0.
Okay, great. And then the big question that I think a lot of people have is if someone ends up testing positive in country, what happens with that? Does the rest of the group also stay behind? Does it depend if it's a student group or an adult group? Does Holbrook help with those arrangements if something happens and someone does need to quarantine in country? What's the procedure for that sort of overall?
And it may vary slightly by country if they have different rules, but for the most part, if one person tests positive, that doesn't hold the rest of the people from traveling home. They can travel home as long as they have a negative test. They can travel home. Suggested they get tested again once they get home, just to be sure. But that person would have to stay behind, and in most cases, it would be until you get a negative test, or if you are more ill, until you can get a certification of recovery letter from a physician before you can come home. Some countries, however, may say a 14-day mandatory stay if they have that rule. But for the U.S. is concerned, you just need to have a negative test or a letter of recovery from a physician in order to be able to come home at that point. If you were traveling with students who are minors, then that would be up to the school or the organization to determine that the leader, I'm assuming that one leader would need to stay behind, and it'd be up to them to determine whether or not the parents would need to fly in or that leader would stay behind. So hopefully it's a group that has more than one adult traveling with them should that happen. And some locations have specific hotels that they want people for quarantine issues. Other hotels, like there were some in Belize, they usually have a quarantine rate that they'll give you if you have to stay. So you're not necessarily paying the full rate for the accommodation. It's not a situation where nobody will take you because you have COVID. But they will, assist you and help you. We are certainly there, and our partners in the field are there to assist in any way at all possible. Unfortunately, we can't make payments for these things, so that's where insurance comes in. Even though it's still, you pay up front and have to file a claim to recover the funds. But so I don't know if that answered all the questions there or not. But if not, we're certainly. Go ahead,
Let me,
Andrea.
let me add something to that. Every country is dealing with this differently. In the case of Costa Rica, until the other day, they were requesting that you have health insurance that cover, or travel insurance that cover COVID sickness, which means they needed to have a certain amount of money just allocated for paying for lodging if you had to be isolated for 2 weeks. That was usually the time frame is from 7 to 14 days. And in that time frame, you're gonna be tested to make sure, the moment that you're negative, then you're welcome to come back. But even countries like Mexico, amazingly, what they did to deal with this is that if somebody came out positive during their testing prior to coming back, the hotels actually, they were offering the testing right on site. And if you, for whatever reason, came out negative, positive, then they will actually void the lodging. You could stay in their hotel if you didn't have any symptoms that would require you to be hospitalized, and you could stay until you get your negative, and then they would release you without having to pay for lodging. Obviously, you're still gonna consume, you're gonna eat. So at the end, they were doing it as a courtesy, which to me was a big surprise to see that coming from Mexico.
Yeah, and then for Costa Rica, recently they changed that for vaccinated travelers. They don't require the insurance. It's still something,
Yeah.
it's, that's what we were talking before. You still want to have something that covers it. If you, or make sure you have a credit card that'll help you out. If not, anyway. But yeah, so as I said, things change all the time. But as far as requirements are concerned, currently vaccinated travelers for Costa Rica no longer are required to show proof of insurance.
I would still say it's recommended, because
Highly
reality
recommended.
it's not that much money, and it's a peace of mind that if you have to stay behind for whatever reason, you have that cover. And it covers also prior to leaving. So if you get a negative, a positive before you go to Costa Rica, it actually covers you too for the time frame. So.
Great, thank you. We're just a little over time. I think I'd like to take maybe one more question and then we'll wrap up. If we are not able to get to your question today, we will be following up, because this is such an important topic and we know people really want answers. I think a few questions that we've received revolve around the return testing to the United States. As you mentioned, Laurie, there's a requirement that travelers test negative before they return back to the U.S. That's a U.S. requirement. What is the procedure for that? And does Holbrook organize that? Is that something that travelers are responsible for the cost of? And what is that? Or do they have to handle that on their own?
Yeah, I'll be happy to answer that, but just to address another question I see in there from Sally. Level 4 is the highest. That there are 4 levels, and level 4 is considered the highest level for the CDC and for the State Department on the other parts. And regarding the testing coming home, there's been another change to that recently, but still, if you are vaccinated travelers, which our travelers should all be vaccinated, then you have to have a negative test 72 hours prior. Should you have someone that's unvaccinated traveling, if you're traveling on your own, they have to do it within 24 hours of travel. So they've made it a little bit more strenuous for them. And the testing is at the traveler's expense, and that may vary from location to location, anywhere from $35 to $100, depending on where you are located and where we have to bring people to test you. As everyone is attested, though, that it's all gone very smoothly. You get your you get your results very quickly at just about everywhere that we've had people traveling to so far. But it's something that we will organize on the group's behalf, and in your final mailing packet, you'll be advised where it will be and what the amount will be that you'll need to be prepared to pay. And most cases, they can take a credit card or cash in most cases for those payments.
Okay, great, thank you. And then for the panelists, maybe I'll ask Melanie if you could just briefly talk about your experience, just sort of as an example for the return testing. Was that a smooth process? Was it obviously Rainier's was out in the in the wilds? Did everything kind of go as expected, would you say?
Yes, absolutely. I mean, it was communicated from the beginning, we'll be doing this on such and such day. And, on the day it was, we're all on our bus, and, we went in 2 at a time or 4 at a time into the clinic, and it was a really neat experience actually just to be in there, because I mean you're in sort of a place that lots of local people are using too, and very well organized, very professional, and very quickly done. You know, it was just seamless, really. I mean, it was nothing. It wasn't. I don't think we really worried about that so much because we knew, you know, it was part of the plan that Holbrook had it planned. We just had to not get COVID. So it was just, you know, it was. We were all just saying like, I hope we all get clear, and there was kind of like a little bit of energy around it, but very, very simple. And again, very nice people, very professional, very well run, no problems at all.
Yeah, great, thank you. Okay, well, I'm sorry that we have to wrap this up, but again, we will be reviewing any questions that we didn't get to today, and we'll be reaching out to anyone who may not have had a chance to have their question answered. But would just very much like to say thank you to all of our panelists, and especially to Paige and Rainier and to Melanie. We so appreciate your time and hearing about your experiences and getting to see your photos, and just want to say thank you so much for sharing. I think it's really great to see what it's actually like in the field. So we'd also like to thank everyone who joined us today. Thank you so much. And with that, we'll go ahead and conclude our presentation. Thank you so much, and have a great rest of your afternoon.
Thank you.
Hi,
Thank you. Thank you so much.
Thank you.
you're welcome.
Bye-bye.
Thanks. Bye-bye.